Kima, I thought your video on female genital mutilation was very interesting, and I have never really looked into that before or really thought about how it connects to OB. So, the four main takeaways that I got from your presentation it's just kind of like what the definition of FGM is, how it's removal of the genitalia for non-medical reasons, and it's common in Africa, Middle East, Asia, and displaced communities. And there are several long-term health effects that could be PTSD, depression, anxiety, along with urinary retention and a higher risk for STIs like HIV. Um, the second takeaway that I got is just that there's different stages. So the first stage is the removal of the clitoris, second, removal of the clitoris in addition to labia majora and minora. Type 3, you were mentioning, was the most severe with the narrowing of the vaginal opening, and it could be with or without clitoral removal and only just a small hole left. So if like they want to have a baby, it would have to be like surgically reopened. And type 4 is just any other harmful procedures like the pricking and scraping and all of that. My third takeaway is that there's a high risk for birth and pregnancies with these, and complications such as like a postpartum hemorrhage, excessive bleeding, and just a need for C-sections is very high for this group. So it's important to be cautious of that, especially for those going into OB and caring for them as a nurse. And lastly, of course, related to nursing, just to have that non-judgmental and culturally appropriate care, even if like not going into OB, you can still run into this issue with many women. So I think it's very important to be aware of female genital mutilation and also connecting that to not just your topic, but any topic. It's just to have non-judgmental and culturally appropriate care. Thanks. Good job.